So number one is improved energy and alertness, because most times, no matter what the sleep issue is, whether it's sleep apnea, whether it's insufficient sleep, whether it's insomnia, most times during the day you're tired. So one of the benefits of fixing and addressing and paying attention to your sleep issues is you have more energy during the day. I had a patient too some time ago who said, you know what, it's hard to put in words, but I just feel like I have more energy. In fact, one of my clients recently ran the Philadelphia Marathon, and how were they able to do that? More energy. And really, this was someone who wasn't even sure they were going to even show up, not to talk of completing this marathon. And so that is one of the most common reasons. And most people want to feel less tired. And I'm sure if you're listening, you probably would say, yeah, I don't want to. So improved energy and improved alertness is one of the benefits. And usually for that, you'll see it right away, right? You will see it right away after a night of good sleep, continuous sleep, high quality sleep. You're going to feel that energy and alertness right away. Number two is improved cognition. I can tell you how many times I have people who say, you know what, I feel like I'm living in a constant fog. I'm having issues with making decisions. I have problems with concentrating and focusing on one thing. And we see that with a lot of our kids, right? They're inattentive if they've not slept well. They may have issues with sitting still in class and following through with instructions. And we as well, especially the fact that I work with a lot of high achieving people. I work with a lot of leaders and executives. And one of the things they say is, well, yeah, I could tell the difference. The type of leader I am is impacted or affected by the type of sleep I get, right? So you may feel a little more dull, but when you address your sleep issues, guess what? You are enhancing that cognitive function. You're improving your executive decision making. You're being a better leader. You're being a better team player. You're being a better professional entrepreneur, whatever it is. So that is another reason why you absolutely want to pay attention to this. Instead of living in that constant fog where it feels like you're just dragging up and down, you're now in a situation where you feel better, you feel more alert, you're able to make decisions faster, you're able to think sharply. I'm laughing because I saw a reel of a woman who was just like talking gibberish. She had no idea what she was saying. And it just sometimes feels like that, right? Sometimes you're like, wait, what did I just say? Wait, how did I string those sentences together? So that enhanced cognition is another one. Number three, this is a big one. This is a big one for women. This is a big one for men. This is a big one even for kids, especially older kids. And that is decreasing the cardiovascular risk. So what is that? With poor sleep, there's a higher risk of hypertension. There's a higher risk of stroke. There's a higher risk of abnormal heart rhythms. And there is just this constant struggle that a lot of people end up dealing with. So I have people on multiple medications for hypertension. I have people with, heart failure. I have people with stroke or heart attacks. That's another one. And that's related to that cardiovascular, so that heart system. So when you get good quality sleep, you're able to get into deep stages of sleep. You're able to get restoration. You're able to get your cardiovascular system to rest. And I have people who have been on multiple medications for hypertension, right? And with fixing their sleep apnea, they're better. We're able to wean them off medication. Their blood pressure is better. They have more energy. And I would say for women, this is something that we don't pay attention to. And I'm definitely imploring us to lean in and get the help we need, because many women, may have strokes and may have heart attacks. And for all we know, sleep issues are playing a big role. So addressing that can decrease your risk of all those disorders. Number four is your mood and mental health. My goodness, I myself get this issue where I feel so cranky. I feel so irritable when I don't sleep well, right? And I had someone come see me recently, and we talked through, we do a very thorough, comprehensive sleep evaluation. And I said, how is your mood? How has your mood been lately? And she burst into tears. She just burst into tears. And she said, I am tired. And because I'm tired, I feel more depressed. I feel more anxious. And the antidepressants, the medications I was given, don't seem to be working anymore because I live like I'm constantly walking around with like a very wet blanket literally over my head. I'm constantly exhausted. And so that is big. Now, I would say that mental health and sleep go hand in hand. So it doesn't mean that, oh, fixing your sleep issues, you just stop all your medications. I think it's very important that you work with a mental health professional, but that is one of the things that you're addressing. When you feel anxious and your brain is tired, the brain is wired, it's going to be hard for you to feel better if you don't get good sleep. So mental health issues, your mood and all of that gets better. That's in fact another one, in addition to that enhanced cognitive function, in addition to improving your alertness. That's one of the things that goes away pretty quickly. You become less snarky, you become less irritable, you are, you have a different perspective in life. And this is something that we see, where you may go to bed feeling like despondent and tired, and then after a good night's sleep, you're like, oh, okay, I guess I could address this, I guess I could figure this stuff out. So improved mental health, improved mood, you will see that change when you improve your sleep. And then number 5, another one that's so important again for women, is your metabolic health. So a lot of times women have issues with obesity, right? And not just women, men as well, right? You may have abnormal insulin, you may have abnormal blood glucose, so diabetes. All of those things are affected by sleep, right? Because when you sleep better, if you treat your sleep apnea, if you have sleep apnea, if you get more sleep, you will start to see a change. I have people, again, similar to hypertension, I have people on multiple medications for weight loss, for diabetes, and things like that. And improving their sleep actually does lead to improved outcomes in terms of their weight gain, in terms of their blood glucose, and things like that. Now it's gotten it's become such a big piece that there's actually medications now that we use to treat sleep apnea as well as obesity. One of those medications is Zepbound. So weight loss medications, they're options. And it's really important, if you're working with a doctor, if you're working with a weight management specialist, that they're addressing your sleep issues. That if you have sleep apnea, if you have poor quality sleep, that they're actually focusing on that as well. It's one of the arms of treatment. In fact, if they're not talking about your sleep, you got to find somebody else because that diet, that exercise regimen or routine, that whatever it is, medication supplement, is not going to go so far if you don't fix, an underlying sleep disorder, if it exists. So this is what I do. I work with a lot of nutritionists. I work with a lot of obesity medicine specialists. And one of the things that we talk about again and again is, okay, let's rule out sleep apnea. Let's make sure they're not struggling and with breathing during sleep, because what that does is it increases your cortisol, it makes your metabolism off, it increases inflammation, and then we start to see all these issues as a result of that. But on the flip side, addressing sleep, I've had people lose like pounds, 20 pounds, 30 pounds by just fixing their sleep issues, literally dropping their weight, dropping their blood glucose to a more normal level because their sleep got better. So when we're talking about medications, again, I am not against medications, please, but these are more sort of holistic strategies that we can use, figuring out the root cause. Why is this occurring? What is going on in my sleep? And how can I improve? If you're waking up multiple times because you have sleep apnea, because you have pauses in your breathing, or you might not even know that, you just wake up and you're still tired or exhausted, or your spouse, your partner says you're snoring, you need to get that fixed. And when you do, when you get that addressed, you're going to see an improvement in all these other things. Number 6 is an improved quality of life. Like you and I'm using myself as an example. I know what it feels like to not sleep well. Overall, just there's just more sort of negativity. You feel like, what is it all about even, right? You feel more discouraged. Your quality of life, your overall life satisfaction is low. Your relationships, your productivity can be affected. But when you sleep better, your quality of life feels better. You wake up and you might not be singing, oh, but you're ready to take on the day much better. It gives you a whole different perspective to life. Quality of life is so important. You do not want to we don't want to just live long, right? We want to live well. So improving sleep, addressing sleep apnea, addressing insomnia, making sure you're getting good quality sleep will help you get there much faster, will ensure you don't just live long, but you also live well. And then number seven, I've talked about quite a number of things. Number seven is, is one of the ones that I think is so personal for most families. And that's better relationships, relationships with your spouse, better relationships with with your children, better relationships with your coworkers. Again, remember I started off with a story of one of my patients that was literally dragged in by his partner, his wife, who said, please work on this because I'm not getting sleep. I'm scared he's going to stop breathing. We have a 2-year-old we got to take care of. And his goal was, I want to be able to walk her down the aisle. And you know what happened with this family? Things did get better. We were able to figure out what was going on with his sleep and, put him on CPAP, which was what he needed because he had a lot of sleep apnea. And who was better for it? The wife was better for it. She actually stopped kicking him out of the bedroom. The daughter is now going to have a parent, right? A dad that's going to walk her down the aisle, right? So sometimes, again, your goal might not be to get 8 hours of sleep. If that's the goal, that's great. But why? We got to look beyond that. Why is sleep important? Why is it important that we get to the bottom of sleep issues, that we address sleep apnea if it's there, that we address, insomnia if it's there, that we make sure that you have a regular sleep schedule, that your sleep habits are optimal. It is not just about getting those numbers. It's not just about your tracker saying you did, an excellent job. It's beyond that. It's beyond that. And I want us to start to look beyond the numbers. I want us to start to look beyond, oh yeah, I got 8 hours of sleep. I want us to look beyond that to the why, right? And your why might be getting better energy, waking up feeling not tired, right? This is a reason why I see a lot of patients, a lot of women too. What do you want to feel? I want to feel not tired. Literally that. I want to feel not tired. I want to feel like I have energy. I want to not need coffee the minute I get out of bed. By the way, that doesn't work. If you want to take coffee, you probably want to take it a little bit, not like super early as soon as you wake up. But you know what, that's a story for another day. But I want to feel less tired. It might be that you want to be a better leader. You want improved cognition. You want to be able to remember things better. You want to make more better, high quality decisions. It might be that you want to not be on multiple medications for hypertension, or you want to cure your hypertension naturally, right? I've heard people talk about that, right? You want to find alternative ways to address your heart issues. You want to decrease your risk of stroke. You want to decrease your risk of a heart attack. You want to make sure that your blood pressure is normal. That might be your why. And your why might be you just want to feel better. You want to feel happier. You want this anxiety, this depression, this mental health issues you've been dealing with all this while to get better without you relying on multiple medications. You want to have a mood that is up. You want to be optimistic about life instead of, you know what, nothing seems to be working. It might be that you want to improve your metabolic health. Now, you've been trying all the weight, the diet plans, you've been on all manner of nutrition plans, you've been on maybe medications, you've done all kinds of memberships in different gyms, and this piece is the missing piece, right? This piece, it might be that. It might be you want to lower your blood glucose naturally, right? You want to have less stress, less cortisol, less inflammation in your life, right? In your body. And that might be what it is. That might be the goal for you. Or it might be that you just want a better outlook in life. You want better quality of life. Or you want a better relationship. You want to stop sleeping on the couch. You want to stop being kicked out of the bedroom, right? You want to stop feeling like you're actually now affecting the quality of life of your bed partner. You want to be around healthy long enough to walk your child down the aisle, like my patient said. Whatever that is, whatever that goal is, I want you to set that in front of you as something that you can achieve by making sure you pay attention to your sleep. This is something you do every single day, every single day. In fact, if you do the math right, you're sleeping for a third of your life, right? The average person is sleeping about 26 years of their life. I know that's quite a number. 26 years of your life, the average person's life is spent sleeping. How about we do that right? Because what you do, what you invest in those 26 years will impact everything else that you do for the rest of your life. So making those intentional decisions, going from a place of we have this goal, how do we get there? Look at sleep, look at how you can improve it. Again, your sleep issues may be multifactorial, meaning there are multiple things going on. You can't sleep, you won't sleep, you wake up too early, you're waking up tired, whatever that looks like. The first place to start is setting that goal and then saying, how do I get there? How do I make sure that um, as I strive towards being the healthiest version of myself, that my sleep is not jeopardized? And that's what we're here for. That's what we're here for at the Restful Sleep Place. And this is what we do, which is very, very unique. A lot of what we do is unique, is we help you set goals that make sense to you, because it's enough for me to just say, oh, yes, XYZ, you improve your cognitive metabolic function, blah, blah, blah. But if it doesn't resonate with you, it's going to be hard for you to connect with the goal. So we set the goal, figure out how to get you there, figure out what is going on with your sleep and why is it that you're tired, and help you get your energy back. And we use various strategies, right? We do supplements if we need to, we do sleep studies if you need to, we treat your sleep apnea with different modalities, different treatment options. And it's not just about putting a square hole, a square peg in a round hole. It's finding what works for you and customizing it, keeping your goal in mind. And so come check us out. We're still accepting patients. I love what I do. I want to help as many people as possible. And it's so easy. It's as easy as going online, schedule an appointment. It's therestfulsleepplace.com. So schedule that appointment today. And you could actually schedule a meet and greet. We have a non-committal meet and greet where I talk to you. We figure out what your goals are. We figure out how we could help you there. And then we can take it from there. So schedule that appointment, therestfulsleepplace.com. And I want you to do me an extra favor. I want you to share this video with somebody that you know would benefit, whether it's a spouse, whether it's a loved one, whether it's someone you've been trying to nudge to get their sleep checked and they've not really paid attention all this while. Send this to them. Let me do the talking for them, okay? Let me do the talking for you. So send them this video, share it, and until next time, I hope you rest well.